Hello, I'm Dr. Mark Dailey, and today we're going to talk about H-Pylori. Many of you have recently found out that you have this pathogenic bacteria living in your gastrointestinal tract. Now, I want you to know why it's important for us to eradicate the organism as soon as possible. H-Pylori is a spiral-shaped bacterium found in the stomach, which along with acid secretion damages the stomach and duodenal tissue, causing inflammation and peptic ulcers. Approximately 30 to 40% of the U.S. population is thought to have H. pylori, but fortunately, most people don't develop ulcers. Even so, according to the National Institute of Diabetes and Digestive and Kidney Disease, H. pylori is a leading cause of ulcers among those who develop them. It's believed that H. pylori's shape and characteristics cause the damage that leads to ulcers. Because of their shape and the way they move, the bacteria can penetrate the stomach's protective mucosal lining, where they produce the enzyme urease, which generates substances that neutralize the stomach's acid. This weakens the stomach's protective mucus, makes the stomach cells more susceptible to the damaging effects of acid and pepsin, and leads to sores or ulcers in the stomach or duodenum, which is the first part of the small intestines. The bacteria can also attach to stomach cells, further weakening the stomach's digestive mechanism and producing local inflammation. For reasons that are not completely understood, H. pylori can, in some situations, stimulate the stomach to produce more acid. The following are the most common symptoms of ulcers. However, each individual may experience symptoms differently. Soon after being infected with H. pylori, most people develop gastritis, which is inflammation of the stomach lining. However, most people will never have symptoms or problems relating to the infection. When symptoms are present, they may include abdominal discomfort, which may be a dull, gnawing pain, occur 2 or 3 hours after a meal. They come and go for several days or weeks. They occur in the middle of the night, perhaps when the stomach is empty, be relieved by eating or taking antacid medications. They may result in weight loss, loss of appetite, bloating, burping, nausea, and in severe cases, vomiting. The symptoms of ulcers may resemble other medical conditions as well, so you must be aware of that. Researchers don't know what causes certain people to develop H. pylori related symptoms or ulcers. It's believed, however, that H. pylori is transmitted orally from person to person through close contact, like kissing, or through fecal-oral contact. Most people are first exposed to H. pylori very early in life, in childhood. In addition to a complete medical history and physical examination, diagnostic procedures for H. pylori should or may include blood tests, stool culture, breath test, and an upper GI in some cases. I thought it was interesting that precocious anemia, which you may or may not be familiar with, it's a very serious disorder which can cause irreversible damage from a deficiency of vitamin B12, may be related to H. pylori. This study detected H. pylori in 56% of the 138 patients with pernicious anemia. Upon treatment and eradication of the H. pylori infection, there was significant improvement of B12 status in 40% of the infected patients. The authors concluded that H. pylori is a causative factor in many cases of B12 deficiency, and that detection and eradication of the H. pylori may correct the deficiency. Also, gastric polyps may disappear after treatment of H. pylori, according to a study. These small growths on the stomach lining can cause stomach pain and bleeding and may become malignant. Endoscopic removal is recommended, but these new findings indicate that this should be attempted after treating H. pylori, which may lead to the disappearance of many of these polyps. Drug use to eradicate H. pylori caused polyps to disappear in 71% of the patients with the polyps within 12 to 15 months. These results strongly suggest that eradication of H. pylori leads to regression and disappearance of hyperplastic gastric polyps. H. pylori the bacteria that cause these ulcers may also cause severe or a severe form of morning sickness in pregnant women. Researchers at the University of Vienna in Austria found that 90% of pregnant women with severe nausea and vomiting, often leading to weight loss and electrolyte disturbances, were infected with H. pylori. The researchers hypothesized that in the early phase of pregnancy, changes in a woman's body fluid concentrations affect the acidity or the pH of the stomach, which may in turn activate latent H. pylori residing in the stomach. But the real takeaway here is that H. pylori causes inflammation and further disrupts the function of a healthy gastrointestinal tract, with its waste products causing not only inflammation but increased toxicity, all of which causes systemic, which means system-wide, stress. So not just in the gut, but in the whole body. Remember, our goal is to restore optimal health. The gastrointestinal tract is the cornerstone. In an effort to reduce inflammation, one of the first things we have to do is remove irritants. Those would include, but are not limited to, H. pylori, parasites, yeast and fungal overgrowths, bacterial dysbiosis, food sensitivities, and a number of others. So we have a lot of work to do, but we're well on our way to restoring optimal health. Thank you so much for your time and your attention. God bless and have a great day.